Well, welcome to the next in our series of Military Medicine 250 podcasts celebrating the 250th anniversary of military medicine. I'm Peter Graves. I'm the media relations lead for the military health system, and I'd like to thank you for joining us as we recognize 250 years of sacrifice, innovation, and excellence in military medicine. Joining me today is Dr. Dale Smith, military historian and Professor Emeritus of Military Medicine History at the Uniformed Services University of the Health Sciences. His educational career spans more than 40 years. Dr. Smith is here to help us unpack what we can learn from the history of military medicine to deliver for the warfighter. Dr. Smith, we appreciate you joining us today and welcome you.
Happy to do so.
So, sir, when we think about America's history, military medicine may not always be front of mind. What type of influence on our nation do you see military medicine having had over the past 250 years? And how can understanding military medicine help us understand our national history?
In some ways, it is fundamental. We have, of necessity, gone to war. From Lexington and Concord to almost the current day. When a democracy goes to war, it puts its people on the line, and unless they believe they're going to be cared for, they don't want them to go, and the soldiers and sailors, airmen and Marines don't want to go. There are countries where you go whether you get care or not, but democracies tend not to be part of that. Congress recognized this fact in the summer of 1775, shortly after it created the Army. It created the hospital department to assure the American people and the soldiers that care would be provided by the best doctors that America could find. And some of our best doctors participated in the revolution, just like some of our best lawyers and soldiers and farmers. The second piece helps win the war. That's force multiplication. It takes two forms. One is health service support, which takes care of the wounded, and the other is preventive medicine, which keeps the people able to fight. Again, in the revolution, the general hospitals returned people to duty and let the regiments move on. And we saw some efforts at preventive medicine. The first army to be immunized is when George Washington ordered the inoculation, that's the deliberate giving of smallpox, to the Continental line at Valley Forge. That made a huge difference in the latter part of the war. The third impact is the impact on general science and medicine. The best example of that in the Revolution is probably John Warren, who joined the Army as a militia doctor, followed the Army to New York, but then was assigned to one of the new general hospitals in Boston, where he recognized that many apprentice-trained physicians had not had the opportunity to do much dissection. And so he taught them how to do dissection, which was essential for both wound debridement and amputation.
Sir, you mentioned Dr. Warren, and you also mentioned that there were other doctors in the Revolution who had an impact on force of the or health of the force. Can you mention some of those other folks and what their contributions were?
Probably the most important is Benjamin Rush. He was professor of medicine at the College of Medicine at Pennsylvania, what later became University of Pennsylvania. Rush was a signer of the Declaration of Independence, a significant American founder. Medically, he wrote a little tract addressed to the officers of the Continental Line on how to keep their men healthy and to assure their morale. He said, visit your men when they're sick or in hospital. Now, some officers did that and some didn't think about it because they were busy with the people that were back in camp. And he said that's important to the man's morale and to his family. Make sure they eat regularly, are clean, get enough sleep. Some of it was common sense. Some of it was medicine. Don't let sick people stay in your camp. Send them on to the regimental hospital, and if need be, back to the general hospital. And that effort to educate line officers sets a tradition that still goes on. Another is William Shippen, who was the professor of surgery and the director general of the hospital department, equivalent of our modern surgeon general. And he was the one who Washington talked to before he made the decision to variolate the Continental line. And so senior staff leadership is also important because you also have to educate senior officers, not just battalion leaders. You have to educate troop commanders, and Shippen's role there was absolutely crucial. The number of people who served who didn't like it but stayed is simply a huge number of the doctors in the country. And that's always a challenge when we mobilize, is when you take the doctor out of the community to go with the troops, you leave a hole in the medical care in the community. And it would be the First World War before we really learned to balance those needs. And in the Revolution, you had literally hundreds of doctors who went for years at a time, leaving their wives and children at home. And since they were officers, there was no stipend given to their families. They had to take that out of their pay and find ways to get it home so the family could eat. And so it was a huge contribution by the entire medical profession.
And I would imagine that their contributions would have been doubly important, because if I remember my history correctly, during the Revolution, you have a new citizen army. You had high rates of desertion, and not because they didn't necessarily believe in the cause, but a lot of these men had farms, and enlistments were not really long, and they had families that they had to take care of. So it would be important, I would think, for the remaining men you have in your lines, you need them to be as healthy as they can be based on the times, because a sick force can't fight.
That's absolutely true. And the doctors set an example for the men by staying. They were closer than most of the officers to the men. And you're right about the enlistments. I mean, most of that army was militia. And they really joined for a 3-month tour. And when the war drug on, I mean, let's face it, 1775 till Yorktown in 81 is a lot more than 3 months. And so many people came and went. Sometimes that was just to see their family. Sometimes they were homesick. Sometimes the family desperately needed them. And that's one reason Congress passed a stipend for the enlisted men to send to their families, is people had to have resources when part of the family was gone. But the doctors made a huge difference. And it made a difference to the wives and mothers back home who knew their troops were being cared for. It's bad enough that they were gone. If they weren't being cared for, it would be doubly bad. And if Mama's not happy, nobody's happy.
Next up, the second part of my conversation with Dr. Smith, where we talk about the surprising history of military medical evacuation and the heroic pioneers you may not know about.
For everyone listening, we look forward to continuing the conversation. As we commemorate 250 years of military medicine, join us wherever you get your podcasts, on health.mil or on any of our social media channels for the most up-to-date military health content.